One major difference between pediatric and adult palliative care is that there's a lot more medical technology in pediatrics. 80% of kids getting palliative care are using some sort of medical device. The most common ones are non invasive ventilation, tracheostomy, and feeding tubes. So, a big part of pediatric palliative care is helping families navigate these big, sometimes agonizing choices. To do this, you really need to know what's involved. Most doctors know how something is put in, but have no idea about what it's like to live with it. When a child is dependent on one of these devices, it has major implications in their care and home life. Take tracheostomy, for example. If a child with a trach is ventilator dependent, a trained adult needs to be by their side at all times in case the tube comes out or it plugs. This includes overnight. A trained awake adult needs to be at bedside. That means that families need daily nursing care in the home, and funding for this varies from state to state. Sometimes there is no funding. You have to think about portability. To leave the house, you always need to bring suction. If you go in a car, a trained adult needs to be in the back seat with the child. And timing is important. Vent batteries last about 6 hours. You have to think about what to do if the power goes off. Does the child go to school? And will a trained aide be available? Will it affect the parent's ability to work outside the home? How will it affect the siblings? How much will it affect the child's ability to speak? And how important is that? The questions go on and on. The decision to get a trach or other medical technology is a very individual choice. It depends on the child, the family, what resources they have, their values and goals. What works beautifully for one child may cause all kinds of problems in another. It can seem like an impossible decision. One mom from CPN says that it's like you're deciding between two bad choices. I'm sure you can see that there's much opportunity for palliative care providers to help by giving anticipatory guidance, support, and sometimes recommendations based on their knowledge of the child and the family. These are some factors that can influence a family's decision on whether or not to pursue medical technology. Number one, familiarity versus the unknown. Management of medical technology can be complicated, and if someone doesn't have exposure to it, it can look very intimidating and even impossible. Yet, thousands of parents without medical backgrounds learn how to change out trachs, unclog feeding tubes, and manage BiPAP settings. Having exposure to other families who are living with these things may help parents make decisions. Number two, not knowing that there's a choice. When talking to a family about medical technology, a range of possibilities should be discussed. There is always a choice, so try to avoid words like should and need. Parents need to know that they are not bad parents if they choose against or for the device. It just depends on what's right for their child. And there's judgment. This is something that isn't talked about very often. It can come in the form of self judgment when parents have a perception about what they should do. It can also come from others. Some in the neuromuscular patient community disagreed with our decision to not pursue a trach for our daughter, and a few even said that we were killing her. This was a shock for me and a very hurtful one. Sometimes patients and families who have chosen one path have very strong opinions about what others should do, and this may influence a parent's choice. I think that medical providers need to be aware of this and support the parent in making the right decision for their child. This is a pediatric pulmonologist interviewed by Courageous Parents Network. I think that he makes two very important points. Number one, the decision for something like a trach is very individual. It's decided depending on the person, not the disease. And number two, when you say need, it seems like there's no other choice.
What I've seen in my own personal experience is that families often don't want that diagnosis, if there is a diagnosis that comes along with that, to define what interventions are considered for them and what interventions are not. They don't want it strictly just based on the diagnosis. They want it really based on their individual child, right? They want the team to understand their child and make interventions based on their goals of what will help their child live as best as possible for as long as possible. I think that really brings up this idea of need and I've probably even already said it during us talking today, where somebody needs, if something doesn't work and the team decides they need a tracheostomy or need a feeding tube, and that idea, that word need, really then seems to take away that idea that there is choice. That if somebody's saying you need this, then you can't say no, I don't need that. That doesn't seem like an option. And so as much as we can, trying to take that kind of language out of decision making and understanding where a family's at and saying there are always options that can be made. They may not be equally in line with your goals, and that's our job together, is to understand what your goals are, and so how those options, what are the pros and cons of each of those options. But there's always options. You don't need to do, rarely, there sometimes are, but rarely do you really need to consider something like one of these.
This next clip is with a mom who had a son with an in utero stroke. She talks about several different interventions they had to decide on. Putting in a feeding tube was a hard choice, but she's very glad she did it. Here, she talks about making a different choice when it came to hip surgery. I think there are two important points in this clip. Number one, parents cannot predict the future, so they make the best choices they can with the information they have at the time. This is all they can do. Number two, notice how she worried about what others would think about her decision and how her doctor freed her of this.
Where as he grew, his hips were becoming an issue with dislocating. He never walked. He never bear any weight on his legs. So those are all things that you need to keep your hips in their sockets. And his were not staying. And his muscle tone played a big part in that. So that was a very agonizing decision. That was lots of sleepless nights and consultations with orthopedic surgery, and Josh and I talking about it. And I think there's a lot of guilt with what if you don't do it? What if you just wait and see if this is going to get worse? And I can remember being in a orthopedic surgery appointment, and I had done these several times, and we had looked at the x-rays several times, and it was sort of coming to the point where I needed to decide what to do, and within a few months we would have to decide this. And I think the doctor looked at me and he realized I was agonizing over this, and he just said, "You're not a bad mother if you decide not to do this." And I didn't know that that's what I needed to hear, but that's exactly what I needed to hear. Because I really...
In this last clip, we hear from a mom who chose a trach for her son and a mom who did not. From hearing them talk, I think it's clear that both made the right choice for their child.
Initially, when I thought of a trach, when they talked to me about the trach, they said, in the future, you would have to, decide whether or not to trach your child. And I'm thinking, no, after seeing that little girl, and the way I thought of it at that point was cutting a hole in my son's throat. No, there's no way. And when he was 11 months old, he kept getting sick. He was on the BiPAP, and we kept ending up back in the hospital. And in February, which wasn't that long later, they said they tried to extubate him, take him off the vent, and they were unsuccessful. And they said, you have to make a decision. Are we going to let him go and do comfort care, or do you want to trach him and put him on a vent? So I didn't know what to do. I didn't know how to answer that question, because my no from before was no longer on the table, because losing my son, letting him go, I didn't want to do that. I didn't want to do that. So they were both bad choices. So I thank God I had my faith, because I prayed every night for 5 days. I said, God, you have to make this decision. I cannot make this decision. I went back and I told the nurses, I'm ready for the PAC team, sat down with them, and I said, we're going to get the trach. So we did. And afterwards, I was so grateful that we had gotten the trach, because Alex had been so weak and he was always struggling, and the breathing was just hard. And after he was put on the vent, he was so much stronger in so many other ways, because he didn't have to struggle to breathe.
For somebody, but he's got this cute face, and not that it's just about looks, but it's not going to extend his quality of life. It's just going to add more to our plate. I have, Isaiah, who would be ripping out a trach. I have a dog with, that's around him with in their clothes. When you see them downstairs, they're all together, Avery, Isaiah, and the dog. It would have added more madness to our life. And so not only the look, but Isaiah, I mean, he pulls his central line on a regular basis. We have to, it just wasn't fitting with our family system. And I had to really decide that what was he going to gain out of it? And any decision that I make for Avery and Isaiah is what is going to be the gain for it? And while, him not having a trach, yes, we have to do deep nasal suctioning and all that stuff, but we figure it out. I just feel like if it's not going to gain him enough, and it's not going to help his quality of life, then it's just not for us.